So even though measles is a new disease that Montana is having to work towards controlling, we do not expect that the spread of measles is going to be like it was during COVID-19. And that's because there is a good proportion of the population that has immunity against measles. And so what we're likely to see with this measles activity or measles outbreaks is that we're going to have pockets of measles activity, and it's going to be mostly among communities or groups of people that have low vaccination coverage.
Several themes kind of emerging in our responses. One being individuals trying to approach this as if it was COVID-19. And so one question that's come up even is, if I place source control on the patient, then I don't have any exposures, right? And the answer was yes with COVID, but the answer is no with a highly infectious airborne agent. And so that I think is one thing, just trying to kind of transition our mindset out of COVID-19, but what are these standard core infection prevention steps that we can take when we have an airborne pathogen? Because this would be applicable to any airborne infectious agent, right? I also think that we've had some very large mass healthcare exposures that have resulted in press releases having to go out with double digit, almost triple digit exposure numbers, which is pretty large when you're talking about public health response and then having to contact all those individuals. So I think if we can stop the exposure from occurring in the first place and have a plan to do so, and then know what to do if somebody enters our facility, because best laid plans, we still could have an exposure occur. A facility could do everything right and we still have an exposure occur. And so then it's, how do we respond to those exposures? And then what infection control mitigation strategies had we implemented to reduce our risk? We may not have a zero risk, but I feel a lot better with a lower risk than a high risk where staff only wore gloves. I mean, that was one scenario where we had a facility say, we thought we did the right thing, we put them in a room we don't usually use, and we wore gloves.